If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
But it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.
A good Saturday morning to everyone tuned in to VOB 92.9 FM. Get ready for a special Easter edition of 15 of the healthiest 10th anniversary minutes you will hear on your radio, all with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and the Barbados Community Foundation. This is Peter Boyce here, and I know you're all fussy this Saturday morning, enjoying your long Easter weekend. Monday gonna be a bank holiday. Yesterday was Good Friday. Did you go to church for Good Friday yesterday? And did you eat fish yesterday? Are you planning to eat fish tomorrow? Well, if you are planning to eat fish, you will be hearing from nutritionist Victoria Cox inside of this show with a tip on how you should prepare your fish for Easter. All of this with the compliments of the Maria Holder Diabetes Center, the place to go for all your diabetic needs. Whether you are diabetic or pre-diabetic, the one name you need to remember is the Maria Holder Diabetes Center. That's where you find podiatry services to take care of your feet. Let me list some of those podiatry services for you in case you forget. Nail cutting, corn and callus removal, biomechanical assessment, wound care, management of ingrown toenails, nail fungal management. All of this and more can be done at the Maria Holder Diabetes Center. Also, screening your eyes for diabetic retinopathy. Last week, we featured a person who went blind because they did not get their eyes screened on time. Do not let that happen to you. You might be one of these people at home thinking,
that ain't gonna happen to me. I just get protected by the Lord.
Well, get protected by the Lord and go to the Maria Holder Diabetes Center. That way, you know you are safe for sure. You remember what clinical lead of the Barbados Diabetic Eye Screening Program, Dr. Charles Spears, said? Listen again.
Everyone over the age of 12 with a diagnosis of diabetes should be having screening checks at least every year. If there are problems found, then we might need to see you more often than every year. If your optometrist or optician is looking at the back of the eye, if they have the equipment to see all around the back of the eye, the retina, then they can also make a referral to the center or to an ophthalmologist if they find anything wrong, if there's any sign of any diabetic eye changes. The advantage of what we're offering, however, is the photograph that we take covers the entire retina. So we're able to pick up these very subtle changes at the back of the eye and then either act on it by referral or referring you for treatment.
And then there's vascular screening. If you listen to this show every week and your 2 feet swell up and you might got bad circulation and you have not called and made that appointment yet for that vascular screening, what are you waiting for? The number to call is 2433937. That's the number to call to get all your diabetic needs addressed, including seeing diabetes specialist nurses and doctors.
My name is Dr. Diane Brathwaite.
Like Dr. Diane Brathwaite, and nutritionists like Victoria Cox.
Nobody can tell me what to cook. Nobody can tell me what to eat.
That might be what you might be at home saying. But once you are diabetic or pre-diabetic, what you cook or eat can make a difference between life and death, or having feet and not having feet. That is why you need to make an appointment with nutritionist Victoria Cox so she can look at what you eat and get you on the right eating track. But this morning, you are going to get advice from Victoria absolutely free. Because as I said before, it's Easter and we know everybody gonna be eating fish for Easter. So let's hear from Victoria Cox on how you should be preparing your fish to eat it.
So if you're preparing fish this Easter, the good thing is that fish is a protein, so it's not going to acutely affect your blood sugar in any way. But of course, you still want to keep it nice and healthy. So avoid deep frying if possible. Try to steam your fish or grill your fish or bake your fish. So just using less oils and butters in the preparation method, as well as try and go heavy with, fresh or dried herbs and spices instead of using particularly salty or high sodium seasonings or seasoning packets. And then from a blood sugar perspective, keep track of your portions of whatever starchy foods you may choose to serve with your fish. Always include your vegetables and, of course, drink your water.
Thank you, Victoria Cox, nutritionist with the Maria Holder Diabetes Center, reminding you listening at home on VOB to drink more water and telling you how to prepare your fish for Easter, which leads us into our song of the day. Especially for the Easter season, we invite you to respectfully dance and sing for Easter this Saturday morning to the music of RPB. I am alive.
Hallelujah. When I wake up in the morning and I see the sun.
The Maria Holder Diabetes Center.
Yeah, I know it's a privilege, yeah, to be alive. Oh yeah, from the rising to the setting. When the day is done, I send up praises, yeah. I know it's a privilege, yeah, to be alive. Oh yeah. Worries I'm not discounting, but I'm counting every blessing. Hallelujah, hallelujah. Every day is Thanksgiving, for every day I am living. Hallelujah, hallelujah. I want to give praise.
The Maria Holder Diabetes Center.
Singing hallelujah, hallelujah, hallelujah. I want to give praise with me hand raised. Singing hallelujah, hallelujah, hallelujah. They one on high, my eyes to the sky. Where my praises go, I will always show. I'm thankful for life, for life, for life. Oh yeah.
The Maria Holder Diabetes Center.
All the pleasure and enjoyment, every moment of fun, I send up praises, yeah. I know it's a privilege, yeah, to be alive. Oh yeah. Every failure and disappointment, when heartache and sadness come,
The Maria Holder Diabetes Center.
yeah, I know it's a privilege, yeah, to be alive. Oh yeah. Worries I'm not discounting, but I'm counting every blessing. Hallelujah, hallelujah. I want to give praise with me hand raised, singing hallelujah.
A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. Vascular or ABI screening. Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937 to get more information and make an appointment. Board members get 10% off.
We now go to the second part of our interview featuring diabetes champion Michelle Thompson. Welcome to the show, Michelle.
Thank you for having me, sir.
Michelle, how long have you had diabetes?
Okay, I would say from 2010, 12, something in that region until now.
And how has it been for you living with the condition?
It's very traumatic. It's very hard because coming from a person of being visual and entertaining, interacting, and being here, there, and everywhere, you're not at a standstill. It's very hard.
Do you have any regrets as it relates to how you dealt with your diabetes?
Yes, I do. A lot of regrets because things I have should have done before, I didn't. And I'm being educated all now, so as you go on, you will know what to do and what to do. First thing is acceptance. Mm-hmm. Okay, you must accept the doctor's investigations and the doctors what they say is happening. And if you do not listen to your doctor, it becomes, as I said, denial. I denied that I didn't have diabetes. I decided to drink the cold water, flush the kidneys, and everything would be okay. Mm-hmm. But unfortunately, that was not the position.
You would have also had your left big toe amputated. What would have led to that?
Well, we like to sit down, lap our foot, and talk yaga yaga, and then, you just sit there you have a corn, and you just pull at it, and I pull at it till eventually realized ain't no more coming off easy. I decided to get a fingernail clip to clip it, and here goes trouble. I did that, and then the toe started giving problems, pain, and you don't know what was wrong with it till you got the doctor to check it out and stuff. And apparently I had picked up an infection in the toe.
Michelle, because of diabetes, you became visually impaired. How has becoming blind impacted on your life?
Okay, in the same time period of just a couple of days before the toe was amputated, this amputation was in 2016. And during that time period, before that, I was seeing the doctor with my eyes. Apparently, I was at work, I had a couple falls, and then walking a straight line, you find that you're swaying. And then you rub your eye, you see this red dot, and you rub your eye, and you decide, must be a hair or something, your eye, you're rubbing. But not into knowing that diabetes had gone so bad out of control that the eye was actually bleeding in the back. I was advised to see a retinal specialist for the eye, and I was told that the retinal detachment in the back of the eye the retinal has been detaching in the back of the eye. So I had injections, I had scans, I had laser treatments and surgery, but they were not successful.
Have you ever visited the dietitian? Tell us about your visits with her.
Oh, dietitian, Ruth is not there longer than there no more, and we have Victoria, but mostly I dealt with Ruth, and she would sit down to you and we would talk, and she would explain the do's, the don'ts. She would show you a chart that have the different things, the don't chart, and she would educate you on what you should have, your portions, the sizes, and what you should have and stuff. And they were very nice. She was a very nice person, and now Victoria, she's there now. She's also a nice also. So if they educate you to a field where some person does not understand what's going on, and they try to open the wider field that you can understand directly towards the lowest layman terms that one would understand.
Did you find the advice that you got from the Maria Holder Diabetes Center helpful in helping you to cope with your diabetes?
Yes, tremendously. I give credit and thanks to Dr. Braffett, Dr. Lovell, Nurse Tracy, Nurse Clark, the receptionist, the dietary, the whole crew is a dietitian. They're lovely ladies, and you can go there and you can sit and they will explain everything to you, even the lowest time speech of English that you can go into the lowest bracket if you don't understand what they're saying. And they're very well professional. The place is very good, clean, nice, and the appearance, everything is good there. I can call Dr. Braffett anytime, any of them, and ask a question. If it's something that they suggest I come in and let them see what I'm talking about, they will find the time for you.
For over 10 years, the Maria Holder Diabetes Center has been effectively serving the diabetic and pre-diabetic community of Barbados with a range of international standard health services, which include diabetic eye screening, vascular screening, nutritional advice, and consultations with diabetes specialists. So if you are listening to VOB right now and you have a diabetic related query or you need to make an appointment, you can call 243-3937. You can also follow us on Facebook or Instagram. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Center celebrating its 10th anniversary. Until next time,
drink more water. Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.